I'm Jamie Snider. I'm a head high school football coach here in South Carolina and been in coaching for about 24 years now. About 4 years ago, my hip really started bothering me, and over the last 4 years, it got worse and worse, and to the point where sitting in a chair for too long a period of time, you had to keep moving and fidgeting and that type of thing, or sleeping at night was a problem, and during football season was the worst. You could never be comfortable, and I almost felt like sometimes on the sidelines I was a liability.
When the hip pain becomes limiting, when you can't do what you want to do anymore. In the old days, that meant you're crippled and you can barely walk. Nowadays, a lot of the patients that I see, they can walk fine. They can walk a mile or two, but they just can't play sports. They can't run for a few miles. They can't play basketball. They can't do the things they love to do. And we have a way to fix that now. In the old days, we did not have a way to do it.
When I found out I was a candidate for hip resurfacing, I was very excited. I knew that was the route for me to go, and I was excited, and I was just ready for the surgery day to get here so that I could start getting my life back.
For a younger person who wants to do heavy labor or they want to do extreme sports, the hip replacement won't allow them to do that, so then they put off surgery, they keep living in pain, and they just can't live their life. If they heard about hip resurfacing, then they'd be able to have an operation that actually meets their needs. With minimally invasive surgery done as an outpatient, you don't need to stay in a hospital. You're walking with crutches for a couple days. You're on narcotic medicines for 4 or 5 days. After that, you can drive a car.
I was walking when I left with the help of crutches, but I think there was something in that fact right there that you walked out of the surgery center, you walked into, yes, with some help and that type of thing, but there's something therapeutic already in that.
By 2 weeks, most people are with minimally invasive hip surgery are back to the office doing office work. At 6 weeks, they're walking a mile, and then at 6 months, they're returning to full impact sports.
Today, if I have to take a little jog, and don't tell Dr. Gross this because I'm not supposed to do that for another month, but if I have to take a little jog at practice or move around, I don't even think about it, and there's no pain, and it was the right procedure for me.
Very few surgeons are doing these as outpatient surgeries. That's a revolution in this country that's going to take place in the next 5 years. At Midlands, we've been doing it for about 2 years now. We've done over 600 outpatient joint replacements, but I believe we're the first group in the state to do it, and there's only probably 10 or 20 groups in the country who are doing high volumes of outpatient joint replacement surgery.
I think one of the things that was the most impressive to me about Dr. Gross when I read the reviews and started researching hip resurfacing was the fact that there are people from all over the world that come to Columbia, South Carolina to see Dr. Gross to have that procedure done.
There's only probably 10 or 20 surgeons in the country who are really proficient in this operation, so patients who find out about it are usually savvy enough to find out who's experienced and who's done a lot of them, and they're willing to travel for that.
It gave me my life back and allowed me to be more active. And not that there's nothing against hip replacement, but hip resurfacing to me, the recovery, the staff, Dr. Gross, it just makes it the right fit for me. For me, finding Dr. Gross was like an answer to a prayer for me.